So today we have an interesting case where there's a subtle issue. It's not huge, it's very tricky. And if you look, there's a little bit of protrusion of the nasal bone in the mid-nasal vault on the right side. And it's only this area. It doesn't extend way too far. So what we need to do for this is a very conservative medial osteotomy. And that goes right here, and an intermediate osteotomy, and the intermediate osteotomy is above the level of the low lateral osteotomy, and then we can just do a green stick fracture and push it in to get it to match the other side so it doesn't stick out. And these are very tricky in terms of knowing exactly how much to do, but intermediate osteotomy can be used really well in certain defined situations, and a lot of times does not get taught, so it's important to have that as a tool. Let's get started. Okay, so we are starting now, and this has to be very precise and very deliberate, and we are using a 2mm osteotome, trying to get a very fine green fracture osteotomy, medial and intermediate, and then push it in, and then you're done. That's all you need. It's very similar to sometimes when you get a nasal bone fracture, which is not the whole nose, but just at the rhinion. At the rhinion, and you feel there's a little tiny triangle that went down. Or when you finished a rhinoplasty and you see that there's like on the dorsum the bone is taken, you just want to bring it a little in, tiny bit, but not the whole bone. That's what we're doing. So let's get started. Let's see how we do it. So I got my tap lady here, and tell her when I'm ready. Gentle tap. Super gentle tap. Super gentle tap. One more gentle tap. One stronger. Thank you. We've done the intermediate part. No, sorry, not the intermediate, the medial part. Now we have to go for the intermediate a little lower. And if you notice, it was curved down, and now it'll be curved up, so we can gently push it over. So we'll go a little lower for our entry point to go right there. Gentle tap. Good. Defining the entry point, and now going on against gentle tap, please. I'll tell you when. Remember, this is all by bimanual palpation, so keep that in mind. Gentle tap. Gentle tap. So we have almost gotten it in there. So now we are going to get a fracture in this area by entering again right here. Okay, now a strong tap. Strong tap. Strong tap. Good, thank you. Now sorry, switching over to going up to the top again. Gentle tap. And one more gentle tap. Thank you. And now just a manual pressure right here. And I heard a little crack, and we're done. That was it. Okay, so we have finished. As you can see, it literally takes a minute of a procedure, and preparation takes a little longer, but you have to be very, very precise. And I want to show you the result here. You can see, if you get closer, you know, that this has sunken in now. Exactly what we had marked preoperatively, it has sunken in, and that's what we wanted. So now with this going in, it will match the other side and look more appropriate. And this is not going to have any bruising because we didn't go way down, which is the lateral, low lateral osteotomy. This is it, little tape and a splint, and she's good to go. And if you use a small 2mm osteotome, you don't even need any stitches in there. Bingo. So hopefully we'll get a follow-up picture and we can show you what it looks. Yeah, my patients are out of state, so I have to count on them to send me post-op pictures. Thank you.